Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider. Coronary angiography and possible angioplasty. Introduction. Sometimes people have serious problems with their heart and the arteries that go into it. Angiography is an exam that helps healthcare providers look at the blood vessels of the heart. If needed, an angioplasty is a procedure to open arteries that are too narrow for adequate blood flow. If your healthcare provider recommends coronary angiography and possible angioplasty, the decision whether or not to have the procedures is also yours. This program will help you understand the benefits and risks of coronary angiography and possible angioplasty. Anatomy. The main function of the heart is to pump blood to the lungs and to the rest of the body. The heart needs blood like the rest of the body. It pumps blood to itself through many blood vessels that go directly to the heart muscles. These are known as coronary arteries. Symptoms and their causes. Cholesterol and calcium can build up in the coronary arteries, forming plaque that narrows the arteries. Blood clots can also narrow or block the arteries. Narrowed arteries do not let enough blood go through. This causes blood flow to decrease, which could lead to a heart attack. Blood flows through normal blood vessels easily. Blood vessels that are clogged with plaque are narrower, making it harder for blood to flow through them. Cholesterol buildup and reduced blood flow cause the heart to work harder. If the condition worsens or the coronary arteries become blocked, the heart can be damaged. Blockages can cause chest pain, arm pain, or shortness of breath. Angiography is a test that helps show the plaque or blood clots in the coronary arteries and helps check for any narrowing or blockage. Other tests such as EKGs or heart tracings and special CT scans can make a healthcare provider suspect that there may be a blockage in the coronary arteries, but these tests do not show the blood vessels. Coronary angiography shows the blood vessels of the heart and allows an angioplasty to be performed at the same time. Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials. Procedure. Your healthcare provider may ask you not to eat or drink for several hours before the procedure. If your procedure is in the morning, this usually means no food or drink after midnight the night before. Check with your healthcare provider for specific instructions. During angiography, the healthcare provider inspects the coronary arteries for blockage. Your healthcare provider can fix a blockage with an angioplasty while the tubes and other instruments are in place. Cardiac catheterization can also measure the strength of the heart's pumping ability. If the angiogram does not show a blockage in the arteries, you will probably be able to go home after the test is complete. The procedure usually takes 1 to 2 hours. This procedure is done while you are awake. Your healthcare provider may give you medication through an IV to help you relax. You will be asked to lie down on an X-ray table. The room may be slightly cold. During the procedure, your healthcare provider will monitor your heart rate, blood pressure, and vital signs. Let your healthcare provider know if you feel discomfort at any time during the procedure. Before the procedure, your wrist or groin area will be cleaned and made numb with a local anesthetic. This may cause some discomfort. This means that you will be awake but will not have feeling in the area during the procedure. A catheter is then inserted through the skin into an artery in the wrist or leg and threaded all the way up into the heart arteries. Whether the catheter is placed in your wrist or leg will depend on your healthcare provider's preference and the state of your arteries. You should not feel any discomfort. Dye is then injected into the arteries and X-rays are taken. You should stay still during the X-rays so that the images are clear. If a blockage is found, your healthcare provider may open it using either a balloon or another device. The procedure that uses a balloon is called angioplasty. The balloon is attached at the end of the catheter and is threaded to the area of the blockage through the artery used for the angiography. The balloon is then inflated to break up the plaque. This widens the artery, allowing more blood to flow through. As the balloon stretches the artery open, you may feel some temporary discomfort. The balloon is then deflated and removed. Following the angioplasty, your healthcare provider may choose to place a stent at the site of the blockage to keep it open. A stent is a small metal tube. It stays in your artery permanently. It may be coated with medication. If a stent is used, it is attached to the end of the catheter and placed at the site. A stent may also be used without a balloon to open a blocked artery. Another way to open blocked arteries is with a small mechanical device that breaks the plaque into pieces. Your healthcare provider will make the decision to use a balloon or the mechanical device during the angiography. In addition to breaking up the plaque, a stent could be placed. After the angiography with or without angioplasty, the catheter is taken out. In order to prevent bleeding from the groin puncture site, you will be instructed to lie flat and not bend your leg. You should not drive right after the procedure. Before the procedure, arrange for someone to drive you home. Ask your healthcare provider when you can drive again. Risks and complications. This procedure is safe, but there are several possible risks and complications. These are unlikely but possible. You need to know about them just in case they happen. By being informed, you may be able to help your healthcare provider detect complications early. The angioplasty may not remove the blockage. It could cause a complete blockage. This is rare. Even if the blockage is removed, the blockage could happen again, or the stent could get moved out of position. This could lead to a heart attack or death. X-rays are used during this procedure. The amount of radiation during this test is safe, but this same amount could be dangerous for unborn children. It is therefore important to make sure you are not pregnant before an elective radiological test. A pregnancy test may be done if you are not sure. The coronary angiography can rarely lead to a heart attack. You may need an unplanned angioplasty or even open heart surgery if this happens. The catheter placed in the artery can rarely injure that artery or other arteries of the body. This may cause decreased blood flow to the leg or arm involved, internal bleeding, or possible strokes. You may need surgery to save the arm, the leg, or your life. These complications are rare. The insertion can also cause injury to a nerve in the leg or arm, depending on where the initial puncture was done. Infections can happen after this procedure, but they are rare. Some people have allergies to the iodine dye used in this test. This could cause death. Make sure to tell your healthcare provider about your allergies and any possible reactions to any sort of dye used on you in the past. In some people, dye can cause kidney failure, which can lead to death. This is rare. Let your healthcare provider know if you have kidney problems. Kidney failure is more likely in patients taking metformin or glucophage, a diabetes medication. Tell your healthcare providers about all the medications you are taking. After the angiography. After the catheter is removed from your groin, you will be instructed to lie flat and not bend your leg to prevent bleeding. If the catheter was placed in your wrist, you should not bend your wrist. A tight band may be placed around your wrist to ensure steady pressure for an hour or longer. Depending on the test results, you will need to stay for a few hours or longer. If a blockage was found, you may need to stay in the hospital overnight. Your healthcare providers will give you discharge instructions after the procedure. Bring a family member or friend to take notes. You may be sleepy and forget the instructions. Blood clots can collect around the stent after the procedure if you had a stent placed. To prevent blood clots, your healthcare provider may prescribe a blood thinner. Ask your healthcare provider how long you should take the medication. Do not stop taking the medication without first discussing the risks with your healthcare provider. Your healthcare provider will give you discharge instructions, which include a number to call in case of an emergency. Call this number if you have any new symptoms, such as fever, numbness or weakness, redness, swelling or bleeding at the puncture site. Ask your healthcare provider to notify you with the results of any lab work done. You may also need to schedule follow-up appointments. If you experience chest pain, you should go to a healthcare facility right away. You should also go to the nearest emergency room if you have difficulty breathing, arm pain, or an irregular heartbeat. If you like this video, please like and share. For similar videos, subscribe to our channel. Summary. Angiography is an exam that helps healthcare providers look at the blood vessels of the heart. If needed, an angioplasty is a procedure that allows them to open arteries that are too narrow for adequate blood flow. The heart needs blood like the rest of the body. It pumps blood to itself through many blood vessels that go directly to the heart muscles. These are known as coronary arteries. Cholesterol and calcium can build up in the coronary arteries and form a plaque that narrows the arteries. Blood clots can also narrow or block the arteries. Narrowed arteries do not let enough blood go through. This causes blood flow to decrease, which could lead to a heart attack. During angiography, your healthcare provider inspects the coronary arteries for blockage. Your healthcare provider can fix a blockage with an angioplasty while the tubes and other instruments are in place. This procedure is safe, but there are several possible risks and complications. These are unlikely but possible. You need to know about them just in case they happen. By being informed, you may be able to help your healthcare provider detect complications early. Thank you for using Explain.